Good afternoon, everyone. This is Dr. Moreau with Causel Call. Today is November 10th, 2024. It's always a pleasure for me to come to you to share information. And we believe that by sharing information, you will be well informed, and that will help you to make better decisions. So as always, I'm going to invite our friends to join us. And after the invite, we will go ahead and begin the presentation. So I'm going to invite a few more people, and we'll begin. All right, so today we are back with disorders. Last Sunday, as you know, I spoke about the election, and the election is over. So we have a new president-elect, and we hope that the next 4 years will bring fruitful decisions for everyone, and we're going to continue to live as a nation and respect one another and help each other. So on Causel Call today, I'm going to continue with our presentations on disorders. So today I'm going to talk about OCD, which is Obsessive-Compulsive Disorder, which is different from OCPD, which is Obsessive-Compulsive Personality Disorder. So today I will talk about OCD. Next Sunday, I will talk about OCPD. So what is OCD? So OCD is a mental health condition in which you have frequent unwanted thoughts that cause you to perform repetitive behaviors. So it can get in the way of normal life and activities. So people with OCD, they usually accept that they have that they need professional help. But people with OCPD, you will see next Sunday that they don't think there's anything wrong with them. So again, OCD is a mental health condition in which you have frequent unwanted thoughts that cause you to perform repetitive behaviors. So we're going to go over the symptoms, we're going to go over the causes, diagnosis, and treatment. So what are the symptoms for OCD? The symptoms may prevent you from getting to work on time or getting ready for bed in a reasonable amount of time. So in OCD, it's made of two parts. So you have obsessions and you have compulsions. So we're gonna go over the symptoms for the obsessions, and then after that we'll go over the symptoms for compulsions. So obsessions are unwanted, intrusive thoughts or mental images that cause you to have intense anxiety. So you have intense anxiety. So what are some examples? Fear of coming in contact with perceived contaminated substances such as germs or dirt. Fear of causing harm to yourself or someone else. Unwanted thoughts or mental images related to sex. Fear of making a mistake. Excessive concern with morality, with either right or wrong. Feelings of doubt or disgust. Excessive concern with sexual orientation or gender identity. Need for order, neatness, symmetry, or perfection. And lastly, need for constant reassurance. So these are the symptoms for the obsessions. What about the compulsions? So the compulsions are repetitive actions that you feel you have to do to get rid of these obsessions. So the compulsions are repetitive actions you feel you have to do to get rid of the obsessions. So what are some of these compulsions? What are some of these repetitive actions that people do? So these compulsions are time consuming and they are temporary. So they are temporary fixed of these obsessions. Examples are arranging things in a very specific way, such as items on your dresser, bathing, cleaning, or washing your hands over and over, collecting or hoarding items that have no personal or financial value, repeatedly checking things such as locks, switches, or doors, constantly checking you have not caused someone harm, constantly seeking reassurance, rituals related to numbers such as counting, refusing to shake hands or touch objects that other people touch, like doorknobs. So these are the compulsions. So these are the repetitive actions that you do to get rid of these obsessions I mentioned earlier. So what are the causes of OCD? What can cause OCD? So OCD are caused by genetics. It could also be caused by brain changes like differences in the frontal cortex and subcortical structures of the brain. It can also be associated with neurological conditions, including Parkinson's disease, Tourette syndrome, and epilepsy. It can also be caused by Pendas syndrome. The Pendas syndrome is pediatric autoimmune neuropsychiatric disorder associated with streptococcal infections. The streptococcal infection can be strep throat or scarlet fever, usually in children, and it could also be caused by childhood trauma such as abuse or neglect. So OCD can be caused by all those 5 different things: genetics, brain changes, associated with neurological conditions, the Pendas syndrome, and childhood trauma. How do you diagnose? How can you get a diagnosis? How could you be diagnosed with OCD? How do you get a diagnosis? Right? So someone with all of those different things I'm about to mention can be diagnosed with having OCD. What are those things? So having obsessions, compulsions, or both. Obsessions, compulsions that last longer than 1 hour per day and cause distress or affect participation in social activities, work responsibilities, or other life events. Symptoms aren't caused by alcohol, medications, or another medical condition. Symptoms that aren't explained by a different mental health condition, such as generalized anxiety disorder, eating disorder, or body image disorder. So anyone with all of those things I just mentioned can be diagnosed with OCD. Again, if you're having obsessions or compulsions, compulsions that last longer than an hour per day, right? That cause distress. These obsessions or compulsions may affect your participation in social activities, work responsibilities, or other life events. If your symptoms aren't caused by alcohol, medications or another medical conditions, if your symptoms aren't explained by a different mental health condition, such as generalized anxiety disorder, eating disorder, or body image disorder, so you could be diagnosed with having OCD. Are there any treatment for OCD? Most common treatment involves psychotherapy and medication. So psychotherapy, which is talk therapy, and medication. So if you have severe symptoms of OCD, they will recommend transcranial magnetic stimulation. So transcranial magnetic stimulation, which is TMS. So if your symptoms are severe enough, that's the treatment that will be recommended. So what are the different types of psychotherapy your provider will do with you in order to help you treat with your treatment? The first one is CBT, which is cognitive behavior therapy. You have ERP, which is exposure and responsive prevention. They will expose you to dirty stuff to help you with your treatment. ACT, which is ACT, which is acceptance and commitment therapy, medication. And you could also do meditation and relaxation techniques that can also help with your OCD. So psychotherapy could involve CBT, it could involve ERP or ACT. What about medications? What type of medications that can be recommended for you to take? Right? You have serotonin reuptake inhibitors, selective SRIs. The selective SRIs like fluoxetine, fluvoxamine, paroxetine, and sertraline, and tricyclic antidepressants. All of these can help. I see my wife watching, so my wife will know more about this than me because she's a nurse practitioner in psychiatry. She has a doctorate in psychiatry, in nursing. So she studies all of these medications. So she will be more in tune with the different medications that you could be prescribed to help you with your OCD. Again, the medication will include serotonin reuptake inhibitors, selective SRIs like fluoxetine, fluvoxamine, paroxetine, and sertraline. So all of these can help with OCD. People who receive treatment, they experience increased quality of life and improve school and work functioning. So people who receive treatment, they experience increased quality of life and improve school and or work functioning. So it is suggested for you to seek treatment when you do have those symptoms of obsessions or compulsions. And if you end up being diagnosed with obsessions or compulsions, then you need to seek treatment. So the treatment will include psychotherapy and or medication. So next Sunday, I will discuss OCPD, which is different from OCD. So again, OCD is Obsessive-Compulsive Disorder. OCPD is Obsessive-Compulsive Personality Disorder. So you will see the difference next Sunday between the two. So I'm not going to go much further into OCD. This is what I had for you today. This is Dr. Moreau for Causer l'École. I want to say thank you to those who are watching. I'm sorry this is in English. This is not in French. I will have other presentations in French regarding this, but today we are solely speaking in English. So I encourage you to maybe watch and use a translation service or dictionary help you, or you can send me some questions, and I will be happy to answer them. So moun ki ta reme ke m pale Creole ou bien français, présentation ça c'est en anglais la fête, ou capable voyer question, ou bien nous n'a fait possible nous pour nous capable répondre en créole pour vous, ou bien en français. Désolé que m pas ka faire présentation ça en français qu'on est là, c'est en anglais lié, mais si vous avez des questions, capable toujours poser questions yo en créole ou en anglais, et puis n'a fait tout possible nous pour nous répondre pour vous. Once again, I want to say thank you for watching. Thank you, sweetheart, for watching. I will see you soon, and I will see you guys next Sunday for Cause l'école. Enjoy the rest of the weekend. I want to say happy Veterans Day weekend to all the veterans like me who fought for this great country of ours. On this Veterans Day, I want you to reflect on those families who have lost their loved ones and who've missed them greatly. I'm sure, and for those of us who are here still alive, and we thank God for our lives, and for helping us continue to be blessed. So once again, enjoy the rest of the weekend, and happy Veterans Day to all the veterans and their families.